endometriosis. We can draw attention to the support for women who are going through the menopause. Half our population are going through the menopause, and up until recently there was not much mention of it. And at best, the provision available in Wales is inconsistent, and that's being kind. There are women in all parts of Wales who cannot access the care that they require. 3 in every 4 pregnant women taking some medication through their pregnancy. Where is the research in what's safe to take as medicine and medication during pregnancy and while breastfeeding? There is a need for investment in that. Those are some issues that are quite specific to girls. And then you have issues that are relevant to the whole population, but where there is a bigger impact on women because of a lack of attention, a lack of investment, a lack of taking it seriously, a lack of consideration of specific needs of women, inequality between women and men. It's as simple as that.
Today, it's costing women's lives, and that's groundbreaking report in 2019, Bias and Biology by the British Heart Foundation, really opened my eyes to what was happening or what was not happening in the treatment of heart disease in women, heart attacks in women being misdiagnosed as anxiety or panic attacks. It was spelt out to me in this way. Cardiac specialists have traditionally been overwhelmingly men. So the needs of women amongst the speciality itself has been overlooked for too long. Migraine, I was talking to a group interested in pushing the agenda forward on migraine recently. It's far more common in women than in men. Perhaps a third of women will experience migraine compared with 13% of men. There may be some underreporting by men, but the higher level among women is likely to be a result of hormonal factors, genetic differences, and so on. 180,000 women in Wales have asthma. Figures suggest that asthma kills twice as many women as men. This is a women's health issue that needs addressing. One charity has said that women have been failed by a lack of research into links between hormone changes and asthma. Asthma and Lung UK said women are stuck in a cycle of being in and out of hospital and in some cases losing their lives because of a lack of research. Research in itself is an area where there needs to be a new focus on women. Russell George touched on this. Clinical trials have traditionally been focused at men, older men, and not enough women taking part. I can see that time is running out. We as parliamentarians today are making this demand to government. Despite what it's promised, we're making that demand to insist that the promises made now are put into action. I know a coalition of organisations have come together to put together its case for a women's health strategy, as we're calling for today. It's time to take action on this. We've talked a lot about health inequalities recently in the Senedd. This is yet another example of inequality, perhaps the most glaring of inequalities that we simply have to stamp out.
The question.
The proposal is to agree the motion without amendment. Does any member object? There is objection, therefore I defer voting until voting time. The next debate is the Welsh Conservatives' debate on child and adolescent mental health. And I call on James Evans to move the motion. James Evans.
Diolch, Llywydd, and I will just wait for members to exit the chamber. Quiet us down just a little bit.
Yeah. Carry on.
Yeah. Thank you, Llywydd. This vital debate today on the mental health and children of young people, I think, is one of the most important debates we've had in this Senedd, and it is a shame that so many members have just left the chamber when we are debating such an important topic. A lot of people in this chamber have personal experience with dealing with mental health problems. I have suffered with mental health problems myself in the past, and I think it's very important that more people come forward to talk about mental health issues so we can destigmatise mental health and allow people to come forward to seek the help and support they need. Young people today have far different issues facing them than those of previous generations. Today's youth live in both the real world and the digital world. They can be influenced and contacted by organisations and businesses that they've never heard of on social media and online forums, creating for them a warped perception of what life is. Many young people are vulnerable and susceptible to being influenced in this way, and if they are sucked down the wrong path, they could struggle to find a way out or seek the help that they need. I speak with young people regularly. I even consider myself a young person, Deputy Clywyd. So I understand the struggles that many of my generation are going through. There is huge concern by many that they can't earn enough money to meet the standards that they think society has for them. Many try and portray they live a glamorous life on social media in order to impress others on platforms. Sadly, this has become very common, with only people sharing the good times and not wanting to show the bad while they sit at home suffering in silence. A survey by Mae'r Cymru found that 75% of young people said their mental health had worsened in the early months of the pandemic. I would say this is due to the media and political choices and the resulting lockdowns, which saw a huge surge in people's mental health declining. This led to a growth in people suffering with eating disorders, with support services very nearly being cut off overnight and many left to suffer on their own. We need to ensure that more staff are trained to identify and support children who are suffering with eating disorders. Currently, medical students receive less than 2 hours of training on eating disorders, and that's over 4 to 6 years of an undergraduate study. Many young people who need specialist services are removed from their communities, away from their family with no support network. So we need to explore the possibility of setting up an eating disorder unit here in Wales. Our schools also play a major role in preventing and dealing with this issue. Schools should be building an emotionally resilient population of young people. Sadly, UNICEF estimates that more than 1 in 7 adolescents aged 10 to 19 live with a diagnosed mental health disorder. If we then add those who are undiagnosed, this is an extremely worrying picture going forward. Our CAM service also play a major role in this area. Sadly, after being the Shadow Minister for Mental Health for over a year now, I've been told by many young people that they have been let down by these services, with too many left waiting for an appointment, with nowhere else to turn and feeling isolated and alone. So we need urgent reform to CAMS to make sure that their support is there when they need it. One of those reforms could be increasing the number of support teams in schools. And I and another Deputy Minister believe that every school should have a dedicated member of staff who deals with mental health within schools to make sure that they're supported. Another thing that me and the Deputy Minister agree on is utilising the third sector, so the void between referral and appointment is filled, so that that young person gets seen straight away, so they're not left waiting to suffer at home. Filling historic vacancies in specialist CAMS posts is also an issue that I'm sure everyone is well aware of, and it's one that we must now needs to be urgently addressed. For the last year, I have been told on a number of occasions that this is a priority, but things are not getting better, they're getting worse. This is an issue too great for politicians just to simply declare it's a priority, yet to fail to deliver the resources needed to match the statements. More money has been welcomed and is welcome, but we need to make sure that that money is delivering the outcomes that we want for our young people in Wales. There are many challenges facing young people in Wales, and sadly those challenges will continue to get worse unless politicians in here do more. There are many triggers which can cause detrimental mental health in children and young people, whether it be bullying in school, forms of actually not knowing where you want to be in life, not being able to get appropriate housing, school pressures. It goes on, and I could talk about that for hours. We must ensure that appropriate support is available for children and young people. but also take steps to address the triggers which can cause detrimental mental health. So we need to set up 24-hour crisis services for children and young people right across Wales, so when they reach out for help, that help can be provided. Too many young people are waiting far too long for an appointment, and many are getting to crisis point before anything is done, and this simply cannot continue. I do look forward to hearing many members' contributions to this debate today. It's a shame that the government did their stand all, as they do every week, and delete all to our motion, and we will be supporting the Plaid Cymru amendment today. This is not a day to pat the Welsh Government on the back, but to do our jobs in this place, to hold the government to account and get an urgent review underway into the viability of children's and adolescent mental health services here in Wales. It's time to act, and I urge all members right across this chamber to support our motion today.
I have selected the two amendments to the motion. If Amendment 1 is agreed, Amendment 2 will be deselected. I call on the Deputy Minister for Mental Health and Wellbeing to formally move Amendment 1 tabled in the name of Leslie Griffiths. I call on Rhina Piorwerth to move Amendment 2 tabled in the name of Sian Gwenllian. Thank you very much, Director Lewis. I'm very pleased to be able to contribute to this debate, and I'm very grateful that it has been moved. Mental health is an issue that we discuss often in the Senedd now, and that's good to see, as opposed to the situation in the past where mental health had next to no attention. It was swept under the carpet. But as I said, it's good to have an opportunity once again, because it's by diligent work that we'll ensure that actions are taken that will hopefully assist people with their mental health. And I'm pleased that we once again are giving attention to mental health amongst young people in particular. We'll support the motion today. We agree with regard to the impact that the pandemic had on the mental health of children and young people. It was an unprecedented period of anxiety about missing schoolwork, of loneliness, of missing out on those experiences that are so important to young people, of losing the support networks and so on. I'm a father to 3 children, and I saw that for myself amongst them. We also regret the time that far too many children and young people are having to wait for support and treatment. The third point, then, with regard to the use of Section 136 powers, takes us to an area that we haven't been given as much attention to, namely serious mental health issues and the implications of that. And looking back on the past 2 years in planning for today, I don't see that ministers in Welsh Government have spoken about serious mental illness at all. And it's very important that that is given due attention.
SMIs, such as schizophrenia, bipolar disorder, often first develop between the ages of 14 and 25. It's a critical stage for young people because of the neurological, biological, cognitive changes of adolescence to young adulthood. It's a big time of big change in their lives, reaching major educational milestones. We often talk, don't we, about the need for early intervention to avoid mental health issues deteriorating. Well, Plaid Cymru has long championed early intervention, including in more informal ways, or perhaps in less formal ways. The one-stop shop drop-in centres you'll have heard us promote along the New Zealand model. Our amendment today refers to pilot schemes being introduced under the cooperation agreement, which I look forward to seeing develop, and they must develop. But these less formal interventions can affect clinical outcomes. Being aware of early signs of serious mental illness is a crucial first step in people getting the help they need. And clinical prevention is important. For many, it's the intervention of clinical teams that prevent further deterioration and illness. Early intervention and preventative strategies offer the opportunity to mitigate the stresses that impact on physical, emotional and psychological well-being at this really vulnerable time in a young person's life. Psychosis affects 1 in 100 people. The first episode is most likely to happen between the ages of 18 and 24. But recent research says that fewer than 1 in 5 young people would be confident in spotting early signs. A quarter had never heard of it. So Welsh Government has to meaningfully invest in specialist psychiatric medical provision in Wales, both now and in the long term.
We've spoken a great deal about health inequalities recently. We spoke about it in the context of women's health a few minutes ago. The inequality that people with serious mental illness face is very significant. They're more likely to facing physical health issues, and they're more likely, and they die 15 to 20 years younger. It's estimated that 2 out of 3 people with serious mental illnesses die as a result of preventable physical conditions. So we have to ensure that there's careful monitoring of the physical health of people who are suffering. Now, part 2 of the 2018 mental health measure says that every young person who receives health care from a CAMHS service is meant to have a comprehensive treatment plan to help them to improve. It appears that many young people don't even know about that. We can't support the government's amendment today, even though there is good work being done in some areas. We can't just accept things as they are. It would be a mistake to do that. Even though we have our own amendment that I have explained the importance of what is discussed there, it's possible that we might not even get to that stage. So what we will do today is we'll support the original motion as it is laid out to increase the chance of receiving support for some of those core principles that are in that original motion. There are so many things that we could touch on when we talk about mental health, but I'm pleased to be able to make those few comments there.
Logan Jones.
Deputy Presiding Officer. I'd like to start by thanking James Evans for bringing this debate to our Senedd today. It is a very, very important subject to discuss, but as the member for Ynys Môn said, it's wonderful to see that we are talking about it now. These conversations are real because the situation that we face is very real, and it's nice to see it's no longer a taboo subject, as you said. As James said, mental health is something that affects us all in one way or another. Most recently, has been said already, with our youngest in society, with the struggles and pressures that they faced in education and growing up during the pandemic. Sadly, despite Welsh Labour continually claiming that mental health and well-being of our children and young people is a priority, as James said, the reality is very different. Children and young people are waiting longer for mental health services, and in some health boards, well over 9 in 10 are waiting longer than the target time for assessments. And clearly these problems are historic. Before COVID-19 hit in Wales, waiting times for children and young people were already long. And concerns have been raised by the Children and Young People and Education Committee nearly 4 years ago now about these problems within the child and adolescent mental health services. I find it... Yes.
I'm not sure whether you recall the numerous reports the Children, Young People and Education Committee did in this area, but our landmark one, Mind Over Matter, recognised that actually waiting times had significantly improved and that the focus needed to go to early intervention. Maybe you ought to have a look at some of those reports.
It's gone back, Lynn, since then.
I'm going to cover that.
Okay, that's nearly 4 years ago we were talking about these problems, and still a lot of action has not been taken, Deputy Minister. I find it staggering looking at the latest figures, which show that less than 2/3 of young people are receiving their assessments within 28 days. And on average, over the last 6 months, 48.5%, less than 1 in 2, was seen within this time period. In my own region of South Wales East, we see waiting times for specialist CAMHS in a bad way, with over 14% of young people waiting over 4 4 weeks for that first appointment. It is clear now that this isn't good enough and that our current services cannot deal with the pressure it's facing. We're now nearly 3 years since the joint thematic review in 2019 and more than 2 years after the 5th Senedd Health, Social Care and Sport Committee's report into Section 135 and 136 detentions. The committee at this time noted that improving service to crisis care services, particularly out-of-hours services, is key to both reducing the overall use of Section 136 and ensuring those discharged from Section 136 following assessment go on to achieve adequate care and support in their community. As waiting times get longer, more and more children and young people are needing crisis support, with 30 under-18s being detained under the Mental Health Act. Simply detaining children and young people won't provide the specialist support they need, so it's crucial that a 24-hour crisis service is made available so that they are treated in a safe and appropriate environment, something which, of course, is a debate on its own. It is clear to me and others on this bench that proposed mental health crisis centres must be set up so that we can ensure people who have mental health issues have a safe place to be assessed and treated, which simultaneously lowering the number of people who are detained and transferred. Sadly, we also see this with autism waiting times. There are estimated 30,000 or more autistic people in Wales, and although everyone has heard of autism, too few people understand what it's actually like to be autistic and how hard life can be if autistic people don't receive that right support. Thousands of children are waiting many months or even years for assessment. A recent study found that 28% of autistic pupils in Wales felt their teachers understood autism, and a new Office for National Statistics data suggests that just 29% of autistic people are in any form of work. Without support, many autistic people develop mental health problems, sometimes to the point of crisis. The time for talking is over. The longer we wait to tackle the true root and causes of the mental health crisis and its treatments, the worse the situation will get. We need clear action and regular updates in this Senedd outlining just how this government planned to tackle the crisis and if their methods are working.
Diolch. I want to start by thanking you for bringing this debate to the Chamber today. Child and adolescent mental health is one of the key issues that young people raise with me across Bridgend and Porthcawl. And in Bridgend last week, it was great to host our Young Persons Fair on this very topic with Bridgend Youth Council, where schools, pupils and local support groups came together to discuss how we can make mental health provisions better for young people in our community. Because as with a lot of issues, or all issues related to young people, there are often very well-meaning adults who assume what is best, and this shouldn't be the case. Any decisions that impact young people should at least have the consultation and engagement to ensure that we provide support that will make a difference. I know that our Deputy Minister is absolutely committed to this. I also wanted to add in that one of our Youth Parliament members from Bridgend, Ollie, who represents the Carers Trust Wales, did also want to say that people's voices and opinions sometimes are overlooked and undervalued in decision-making, so we do want to make sure that that is always a priority. I believe it is worth as well remembering the integral role that I think young people have played in bringing the conversation around depression and anxiety into our daily lives. We owe much of the work that has been done to break down barriers and the shame of talking about mental health to young people across our communities. And I know this is a priority for our Youth Parliament member for Bridgend, Ewan Bodley, who said that since the pandemic, it has been easy for young people to feel alienated, and it is only through engaging with young people that things will improve. And at the Mental Health Fair, our Youth Mayor Zander said young people have been calling for mental health to be a priority for too long. But the pandemic has shown how important it is that we make sure services are available and mental health is a priority going forward. I also want to say that I am thankful to the Welsh Government for their commitment to prioritise mental health for young people through schools with the whole school approach. There are already schools across my constituency doing this work, with Porthcawl Comprehensive School working with local mental health support groups to destigmatise reaching out and ensuring that all young people know where to turn to if they need to. But this should be standardised, and every child or young person should know where to reach out to. Every child should be given the tools to have access to support when and if they need it, for whatever the circumstance is. I want to end by saying I didn't actually plan to speak on this today. But, James, I want to say this in support for your call for an eating disorder unit in Wales. I would preferably a residential eating disorder unit. I myself had anorexia nervosa when I was 14. It was absolutely terrifying for me and my family and my friends and my teachers. And I actually had a chat with my mum about it a couple of months ago. I think it was weeks ago, sorry, when we were doing the debate on eating disorders, because I wanted to speak on it. And my mum actually told me, there was something that she never told me before, which was that my paediatric consultant at the time wrote to my counsellor, didn't even tell my parents this, didn't give them the heads up, that I was 2 days away from them admitting me to the adult psychiatric ward at East Glamorgan Hospital when I was 14. They would have locked me up in the adult psychiatric ward at East Glamorgan Hospital. I would never have come out. I would never have come out. So the only other solution, the only other option at the time was a residential unit that was in Bristol, and it was full. And my parents were just, you know, so scared, so scared. I think, to be honest, I was so unwell. I don't even think I was scared anymore. I didn't know what was going on. I did recover, and I'm very rare. Like, you look at the statistics, it's very rare to recover from this. And I did. And I can't even really tell you how I did, even now. But I just wanted to say, that was 20 years ago, and we still don't have a unit in Wales. And in my community of Regent, we do have mental health matters. And it was only actually a couple of years ago I met Michaela at Mental Health Matters, and she had an eating disorder group where people who are suffering with it, but also their families, can come together to get support. And I'd never really talked about this. And I went in, and it all just came out, and we laughed, which I know sounds really strange, but like, there's just things that are so sometimes like bizarre, especially about some of the things you do when you're going through this. And she just made me feel so, I just thought to myself, God, I wish I'd had you when I was that age. I wish I'd had you, I wish my parents had had you at that age. So I know, Minister, you're doing so much on this. I know that we've talked about it before as well, and I always really appreciate your support. But if there is any way that we can have a residential eating disorder unit in Wales so people don't have to, well, just so there's more space and they don't have to move away from their home. Again, at 14, I don't know how I would have gone off to Bristol like that. So, yes, thank you. And if, again, I just want to end by saying to any and all young people out there, I always say to you, you are not alone. There is nothing wrong with you. There is help available, and you can get through this.
Samuel Kurtz.
Diolch, Dipper Lywydd, and I refer members to my register of interest, and I don't think any apology should be made for this debate this afternoon being not a comfortable one, and every contribution we hear is incredibly pertinent to this debate. I'd like to pay tribute to Sarah Murphy for sharing with us her incredibly personal story, and thank you for taking the time to share that with us. I don't believe this debate is to shame the Welsh Government or whip up disgust. Rather, as the member for Brecon and Radnor rightly said, it's to hold the Government to account, and it's to draw attention to the real entrenched failures within Wales's child and adolescent mental health services. These failures have seen the lives of children and young people torn apart and thrown into turmoil. However, I don't wish to use my contribution this afternoon to draw members' attentions to the situation. I do, rather, wish to use my contribution this afternoon to draw members' attentions to the situation in rural communities right across Wales, one that has seen how mental health services are under-resourced and lacking in funding. Now, it is true that growing up in rural Wales is a blessing, and that's not to say it isn't without its challenges and difficulties, a situation which is especially the case when it comes to our young people. Rural isolation is an issue that transcends every societal group, but is often our young people who are left without the support network they need to develop relationships and emotional growth. Lacking these networks and without the required support and the preventative measures, our young people are often left to battle depression and other mental health illnesses, a situation which then requires the professional intervention of child and adolescent mental health services. Looking around this chamber, how many of us had to deal with directly and intervene directly in an individual CAMS case because resources were not available to get a child or young person the vital help they need? I know one of the very first cases I dealt with after last May's election was that of a young girl with an eating disorder. And for me, representing a rural constituency, interventions such as this are all too common and far too familiar. The latest CAMS waiting list figures show that less than 2/3 of young people are receiving the required local primary mental health support service assessment within 28 days. In the yw'r University Health Board region, which includes my own constituency of Carmarthen West and South Pembrokeshire, just 3.2% of CAMS referrals are seen within 28 days. 3.2%. In comparison, Cardiff and the Vale University Health Board conduct 91.3% of their local primary mental health support service assessments within that 28-day window. A difference which, for many, could be the difference between getting the support and access that these young people need, or a further darkening of the clouds around them. But let us be clear, these problems aren't a result of the pandemic. They are unfortunately a symptom of a historic trend of limited access and diminishing resource. It's where failures such as this occur that our local communities and, as the member for Brecon and Radnor rightly pointed out, the third sector pull together and provide the support that is needed. And no better has this been done through Wales's young farmers community. As I've said on a number of occasions in this chamber, Wales's young farmers clubs provide more than just an opportunity to develop agricultural skills and knowledge. They also provide a number of life skills, but also a sense of companionship and support. Lifelong friendships are developed and support networks created, both on a local level and throughout YFC. It's not easy to quantify the value that these relationships have in supporting those members who may be experiencing mental health issues. But on an informal basis, to have a confidant who understands the challenges and uncertainties that many young people have growing up, this should not be undervalued. I'd like to take this opportunity to draw attention to Llysofran member in Pembrokeshire YFC, Hannah Rees, who off her own back brought forward to Wales YFC a plan to provide further assistance to young YFC members throughout competitions days. And I think the fact that this is a young person, knowing that there is a gap there and looking to fill that gap herself, I do pay testament to Hannah Rees and the work that she's doing. But these organisations shouldn't be alone, and it isn't always enough. That's why ensuring that our children and adolescent mental health services are equipped with the resources they need is so important. Regardless of our political affiliations, we have a duty in this chamber to ensure that every child has access to the health services they need, but as you've heard this afternoon, that sadly isn't occurring. Waiting lists are exasperated, demand is too high, and staffing numbers too low. This motion before us is our opportunity to change the way in which our CAMS services operate, making sure our children have access to the mental health services that they need and deserve. Diolch,
Jane Dodds.
Llywydd, and can I thank James for bringing this debate forward? Diolch yn fawr iawn, James. I'm very grateful to you. I speak as a former child protection social worker who worked for around 25 years with children and young people. Part of the battle for me was actually getting those children and their families into CAMS services. I just want to recognise a few things in Wales that I think have gone well. I'm really pleased to see the whole school approach to mental health continue to be rolled out, because a focus on prevention and trauma-informed school environments are incredibly important in nurturing positive mental health among children and young people. But we are in a really difficult place, and I'm going to listen to the rest of the debate to decide how I vote this evening, because it really does concern me that there are two major issues. One is the CAMS waiting time. It is far too long, and I'm looking forward to hearing from the Minister what the figures are around the waiting times, because I'm a little bit unclear what they are, and we heard from Lorraine Rees in the debate, but I've read some different figures this morning, so I would ask the Minister just to clarify what the waiting times are for 4 weeks or more. My own view is that we need a panoply of services. I'm not sure it needs a whole new service. We've got some really good services. The Crisis Resolution and Home Treatment Service provide a rapid community-based service 24 hours a day, 7 days a week, 365 days a year, but it's only for young people over the age of 18. We're talking here about getting to those situations long before. So really, I
I think there are really two important issues. One is, as I've said, that waiting list, and in my experience as a child protection social worker, it is far too long. If you can get in early, you can prevent those children and young people and their families struggling with those mental health issues and potentially becoming looked after children, which is a terrible state to think that that's what happens to many children and young people. And secondly, I would like to pay tribute to the voluntary and third sector services across Wales. There are some amazing ones. And I actually think, and in my experience, young people actually prefer to go to those volunteer services much more than they do to statutory services. They feel much safer going to a service that doesn't have the word NHS over them. We actually need to work much closer with those volunteer services. There are many, like youth sheds in Blaenau Ffestiniog that I visited last summer, Brecon Mind, the Amethyst Project in Aberteifi, the Sanctuary in Pembrokeshire. My view is that the Welsh Government needs to look at these services and map them out for us to see how we can create further capacity for them to meet the needs of children and young people who are experiencing mental health difficulties, and to give them sustainable long-term funding, and to see whether they can provide the 24/7 approach, which I believe is absolutely invaluable. I'm going to end with a quote I heard from a young person. It's always the ones who are making others laugh and smile who are struggling the most. We have to take that into account, and we have to see that young people are really suffering in silence, and we need to reach in there and to help them. And I believe that that is through a form of 24-hour, 7-day-a-week service that really helps those children and families at the time that they need it, before it's too late. Thank you, Diolch yn fawr iawn.
Hussain.
Thank you, Deputy Presiding Officer. Thank you for the opportunity to contribute to this debate. Delivering high quality and effective mental health services for children and young people must be a greater priority. There needs to be a greater focus on prevention, not just reactive provisions. So supporting good mental health as part of a program that ensures measures are put in place to reduce the likelihood of ill health occurring in the first place. There have been calls for a review into the transition phase between young person and adult services within the NHS. ITV News recently covered a story of a young woman with autism. She called for a change in the system so young people moved into adult care don't experience a significant drop in the services they receive. It was suggested psychiatric sessions were reduced from 1 hour to just 10 minutes. This can be significant for young people at such a vulnerable period. In response, the Welsh Government announced an additional 50 million to mental health services in the period 2022 to 2023. But what is the strategy to make sure this money is used effectively to allow young people to make a smooth transition into adult services? And how confident are the ministers that they are doing all they can to reduce the risk of harm to those moving from child to adult care? Now I want to turn to the challenge and the impact on young people. The Young Mind Survey report found 80% of children and young people were existing mental health problems agreed their mental health had deteriorated during the lockdowns. This figure does not include new cases of mental health decline. 91% of young people have access to mental health services at some point. Young people from low-income households seem to be particularly affected. Isolation from friends and family and the shutdown of the vital services have contributed to this. Worryingly, nearly half of the young people experiencing mental health declines have used negative coping techniques such as self-harm. Some have experienced significant dietary changes. Even though isolation is a major contributory factor to mental health deteriorations, over half now feel anxious about returning to normal life. It is clear the impact of the pandemic will be felt for a significant time. These facts are concerning and must be considered by the Minister planning for the future of the mental health. In February 2022, a Senedd report found 60% of children and adolescents who required specialist care had to wait more than 4 weeks for a first appointment. I have few suggestions which I hope the Minister will consider. The Welsh Government needs to consider a new Mental Health Act which would update current legislation and would include the latest thinking around mental health provisions in Wales. The UK Government are currently making changes to Mental Health Act 1983, which must be considered when changing the mental health legislation here in Wales. To ensure a new mental health bill is fit for purpose, the overreaching principle should be ensuring patient view and choice are respected, ensuring the Act is used at least restrictive way possible, able to ensure parity between mental and physical health, and lastly, the patient should be treated as an individual. Additionally, the Welsh Government should consider changes to Section 136 of the 1983 Act, which could help significantly reduce the number of detentions. For someone to be detained, it must be clear that the best interest of the patient can only be achieved through detention. This principle will reduce wearing out of the patients, allowing for better care for those who need to be detained and remove undue stress for those who don't need it. The Welsh Conservatives welcome dialogue between the Westminster and Cardiff. However, mental health is devolved, and this provides an excellent opportunity to deliver a Mental Health Act that not only includes the benefits of the UK Government proposed that ensures the parity between the mental and physical health, but is also fit for Wales. We also need to ensure collaboration with mental health charities such as Young Minds, who, with additional funding from the Welsh Government, can provide specialist support for children and young people. This will address the prevention agenda. For children, a poor experience can be life-changing. So let us up our game. Thank you.
I call on the Deputy Minister, Lynn.
And thanks to all members today for their contributions. There is nothing more important to me than improving, protecting and supporting the mental and emotional well-being of children and young people in Wales. I have stated and restated my commitment many times in this chamber, and I remain determined for us to make the progress needed to transform their lives for the better. It is in fact the very reason I came into government, following 5 years of campaigning on this in the last Senedd. And we all have a role to play in this. Young people have said to us, don't medicalise growing up. We can all help to challenge the narrative that all young people need specialist support when they are struggling. Most young people won't need it, and every one of us in this chamber should be raising awareness and supporting young people to access the appropriate level services when and where they need them. I absolutely recognise the impact the pandemic has had on mental health and mental health services, and as I said in my intervention to Laura Ann Jones, we were in compliance with the waiting time targets prior to the pandemic, which is precisely why the previous Children's Committee called for a renewed focus on early intervention, because they recognised, the committee I chaired recognised the progress that had been made on waiting times. Waiting time performance has deteriorated significantly from pre-pandemic levels, but this is in the context of increased referrals and patients presenting with higher acuity and complexity to a dedicated but pressurised workforce. Whilst waiting times in some areas have increased, health boards provide assurance that waiting lists are clinically reviewed on a regular basis, with patients prioritised based on clinical needs. The latest data published this morning does show steady improvement in waiting times since December, which I cautiously welcome, but I'm in no way complacent about the ongoing challenges we face. And can I say to Jane Dodds that all the data on waiting times is published every month. I'm pleased to say that in Powys we are meeting the target to see 80% of young people within 4 weeks, and there is variation in Wales, particularly with Cardiff and Vale distorting the picture, with more than 50% of the young people waiting being in Cardiff and the Vale. Give way to Darren Miller.
Committed you are to this cause, and you've been very passionate about it for many years. It's not just about the 80% target, though, is it? It's about making sure that people get access to the talking therapies, in particular, that they're currently having to wait for very long times for, even after they've been assessed as requiring within the target time. Can you tell us what progress is being made to address that particular issue?
Thank you, Darren. And as you say, it's not just about the waiting times, and I've myself called for there to be more of a focus on outcomes and what happens to young people once they have that assessment. And we are currently working on validating the data so that we can provide more public information on access to psychological treatments. But I think what you've just said really shows that it has to be a whole system approach, which is what we are trying to do, really. So as we emerge, we've strengthened our arrangements to monitor both the quality and performance of NHS mental health services by meetings with the NHS delivery unit on a monthly basis. And given the variance in waiting time performance, we've also commissioned the NHS delivery unit to undertake a review of both primary and specialist CAMs. This will help us understand the variance and will support our improvement programme, because we have to have the correct data. As we emerge from the pandemic, our services need time to recover and to develop models that can meet the changing needs of individuals and do it sustainably without destabilising other parts of the service. My focus is on prevention, early intervention and strengthening specialist services for those young people that need that level of support. This includes our joint ministerial whole system approach, which has our schools at the centre of improving the emotional well-being of young people. Our approach includes supporting good mental health through the curriculum, helping schools to identify and support young people who need help sooner, but also linking to advice and support from CAMs with the rollout of the CAMs in-reach service. So indeed, James, we are actually doing all the things that you have referred to. We continue to drive implementation of our NEAT framework across Wales via RPBs, and we're supporting the framework implementation in a systematic and integrated way. All young people need safe, nurturing relationships with trusted adults wherever they live their lives. This is at the very heart of our NEST framework. Crucially, this will help provide early emotional and mental health support for those who do not need clinical support or intervention. And I've been pleased to hear first-hand from RPBs of some of the new and expanded services implemented as a result of the NEST framework. A framework which has been co-produced with a wide range of stakeholders, but crucially with young people themselves. We continue to strengthen our Tier 01 offer for young people, providing easy access to a range of support without the need for referral. And we've updated the Young Person's Mental Health Toolkit, which links young people aged 11 to 25 to websites, apps and helplines that deal with anxiety, low mood, bereavement, advice on keeping well and building resilience. And we have extended our rollout of online CBT via Silver Cloud to include a new model for young people. To progress our transformation of specialist services, we are implementing single points of contact for CAM services in each health board, ensuring easier access to the right level of support. And to improve how services respond to mental health crisis, health boards are working towards the full rollout of 111 Press 2 for mental health for all ages. This will provide immediate access to a mental health practitioner over the phone 24 hours a day to provide advice, support and referral. Health boards are phasing in this service and the early evaluation is promising. We will be supporting Plaid Cymru's amendment today and its reflection of the joint commitment we have made in the cooperation agreement. But I want to be crystal clear that our commitment is to pilot community facilities to support young people in crisis. They will provide an alternative to hospital admission, but will also be able to provide clear referrals into NHS services if needed, and will be available on weekends and evenings. We are in the early stages of 4 pilots in Llanelli, Aberystwyth, Wrexham and Swansea to test sanctuary provision for young people. These models will aim to support the young person and prevent the need for escalation. If successful, this model could also provide an alternative to Section 136 detentions when appropriate. But I also want to emphasise that this Welsh Labour Government is already taking an approach to protect the mental health and emotional well-being of children and young people that has early intervention and prevention at its very core. Our whole school approach, NEST, CAMS InReach, improved access to Tier 0 and 1 services are already being funded and rolled out across the country to ensure we make progress on this agenda. Having a sustainable, multi-professional mental health workforce is, of course, fundamental to the improvements I've talked about. And I met Health Education and Improvement Wales and Social Care Wales yesterday to receive an update on their new mental health workforce strategy following their extensive consultation. And of course, the approach I have set out today is supported by our continued additional investment in mental health services, with £50 million additional funding this year, rising to £75 million next year and £90 million in 24 to 25. Over £21 million of this extra funding this year will go directly to the NHS to support priority areas, including CAMS, eating disorders and crisis care. This is significant and recurrent investment which underpins the whole system approach we are taking to supporting the mental and emotional health of all children and young people in Wales. Diolch yn fawr.
I call on Gareth Davies to reply to the debate.
To thank everyone who took part in the debate this afternoon on such a vitally important topic. Child and adolescent mental health services have been severely stretched for many years, but the problems have been compounded by the pandemic, which has been widely referred to during today's debate, and both in terms of waiting times, but also in terms of increasing the numbers needing support. Bernardo's Cymru staff are reporting there has been an increase in mental health and wellbeing issues amongst the children and young people they work with. As a member of the Health Committee, I was able to take evidence from witnesses on the state of mental health services during our inquiry into waiting times. We heard from the Royal College of Psychiatrists, amongst others, who highlighted how mental health services were struggling well before the pandemic. They said that waits and barriers to access would be unacceptable in any other area of medicine. And we heard from stakeholders the very real costs of these waits, as delays in treatments have significant consequences for young people, not only intensifying their suffering, but often leading to more complex needs and increasing treatment costs. We are forcing more young people into mental health crisis because of our lack of early intervention. The fact that that's half of young people receive an assessment within 28 days of referral should be a matter of national shame, particularly when we have been aware of the issues facing CAMS for many years. It is past time we had an urgent review of CAMS provision in Wales, as James Evans outlined in opening the debate. He was very brave to stand up and talk about some of his personal experience. Yes, of course.
Did you actually listen to what I said when I explained that we are having a review, a delivery unit review of CAMS services in Wales? So we are actually doing what you've now stood up and called for. Maybe it would help if you paid attention.
Well, yes, I was actually paying attention, but it was to highlight the actual need for the review in the CAMS services, which has been long delayed and is well overdue. So Minister, I'd really welcome some urgency on that CAMS review, and be keen to hear a statement from yourself in due course as to how you're getting on with that. As mentioned, James mentioned personal experiences, which is very brave of him to stand up in here and say that. And we need more people to come forward to raise
raise the profile of mental health and tackle some of the stigmas around it, and some of the social media and the modern platforms and the grandiose nature of some of the social media platforms often portray a false view of life, which can feed into some anxieties around some social situations. And of course, the COVID-19 pandemic, and you're calling for the need for an eating disorders unit, which is all great progress, and the need for indeed for 24-hour crisis centres for children and young people. And then we heard from Rhys Apiorwerth, who again mentioned the COVID-19 pandemic and school pupils missing out on schoolwork and contact with peer groups, which is all too important with young people growing up. And the main point he raised was the serious mental health issues. Because we all hear too often in the media about anxiety and depression, which do play a big part in mental health, but it's also the recognition of the more serious mental issues, sometimes like bipolar, schizophrenia, psychosis, and the need for the first episode prevention in psychosis to treat people as they're coming into services, and rather spending a lifetime in services is nipping that in the bud when they're quite young. And I think that was a really good point you raised today, Rhys. And then we heard from Laura Ann Jones, the disparities of some of the Welsh Government provisions and what's actually in reality. And as the point I made about the two-thirds of people aren't being seen within the 28-day period, which we really do need to see improvement on, and getting the right support for children with autism and learning disabilities in schools and in the general public. And then we heard the personal case from Sarah Murphy, and I'd really like to applaud you again on showing that bravery, because it takes a hell of a lot of bottle to get up in here and talk about, something that you've really suffered with as a young girl. And, I really take my hat off to you, and you've come obviously a long way from that. And, regardless of party politics, the good people of Bridgend and Porthcawl have put their trust in you to represent them here. And I applaud you for that. And you're doing really well. And then we heard from Sam Kurtz about holding the Welsh Government to account on the variations in rural communities in comparison to larger cities and urban areas, which we all know too well about. And then we heard from Jane Dodds about her experience in the social work profession, and seeking clarification on those waiting times, which the Deputy Minister was able to respond to you on. I was listening, Deputy Minister, just for clarity. And the positive stories coming out of some of the services in terms of home treatment team, and the voluntary third sector support that's available as well, which you rightly say is a preferred method of seeking care for some people, particularly younger and children who we're speaking about today. And then Altaf Hussein mentioned about the transfer between the children and adult mental health service, the smooth transition. And I think, if there was reassessments that were more prevalent between those transitions between those services, we could see a more seamless transportation in between those systems, which I'll be keen to see progress on. And of course, the Mental Health Act in Wales, and what that can mean for Wales itself in a UK context. And I thank the Deputy Minister also for your response today and updating the Senedd today on some of those initiatives that the Welsh Government are working on. I'd like to see regular updates to the Senedd about how you, like I've mentioned, about how you're getting on with that, as it's such an emotive and personal issue for a lot of members and people across Wales. So we'll be keeping a good eye on that. And I just end my contribution in urging members, if you do feel passionate about this and agree with the points that are been put forward by the Welsh Conservatives today, then I'd urge you to support our motion today. Thank you very much.
A question you whether derbyn y cynnig heb a
The proposal. I heard an objection, so I will defer voting on the motion until voting time. And we now have reached that time, and in accordance with Standing Order 12.18, I will suspend the meeting before proceeding to voting time.
The first vote this afternoon is on the Plaid Cymru debate on women's health, and I call for a vote on the motion tabled in the name of Sian Gwynhian. If the proposal is not agreed, we will vote on the amendments tabled to the motion. Open the vote. Close the vote. In favour 24, no abstentions, 24 against. And as required by Standing Order 6.20, I exercise my casting vote against. Therefore, the motion is not agreed. I call for a vote on Amendment 1, tabled in the name of Leslie Griffiths. Open the vote. Close the vote. In favour 24, no abstentions, 24 against. And as required by Standing Order 6.20, I exercise my casting vote against the amendment. So, as the Senedd has not agreed the motion without amendment and has not agreed the amendments tabled to the motion is therefore not agreed. Next, we vote on the Welsh Conservatives' debate on child and adolescent mental health. I call for a vote on the motion tabled in the name of Darren Miller. If the proposal is not agreed, we will vote on the amendments tabled to the motion. Open the vote. Close the vote. In favour 24, no abstentions, 24 against. And as required by Standing Order 6.20, I exercise my casting vote to vote against the motion. The motion was not agreed in that vote. I now call for a vote on Amendment 1. And if Amendment 1 is agreed, Amendment 2 will be deselected. I call for a vote on Amendment 1, tabled in the name of Leslie Griffiths. Open the vote. Close the vote. In favour 24, no abstentions and 24 against. And as required by Standing Order 6.20, I exercise my casting vote to vote against the amendment. And Amendment 1 is not agreed, so I now call for a vote on Amendment 2, tabled in the name of Siangwyn Hian. Open the vote. In favour 48, no abstentions, none against. Therefore, Amendment 2 is agreed. I now call for a vote on the motion as amended. Open the vote. Close the vote. In favour 25, no abstentions, 23 against. Therefore, the motion as amended is agreed. And that brings voting time to an end for today. We'll move now to the short debates, and I call on Gareth Davies to speak on the topic he has chosen.
Leave him, be quiet, to let Gareth have his short debate.
Diolch yn fawr iawn, Deputy Llywydd, and it's me again. I've agreed to give a minute of my time to Samuel Kurtz tonight. And over the past few months, I've been surveying my constituents in the Vale of Clwyd to ascertain their biggest concerns, as well as their key priorities for the Senedd. As we emerge from the pandemic, one of the most startling themes to emerge was the sheer number of respondents who listed access to healthcare as their #1 issue. The pandemic has certainly put our health and care systems under enormous pressure, but we knew access to healthcare was a problem before COVID. Well before the novel coronavirus made an appearance in the Wuhan region of China in early 2020, our citizens were struggling to see their GPs, driving hundreds of miles to get dental treatment or waiting years to get a hip replacement. We became used to seeing lines of ambulances stacked up outside our hospitals. Winter pressures had become year-round pressures. We were as likely to see ambulances queuing outside emergency departments on August Bank Holiday as what we were on New Year's Day. And as someone who worked on the front line of our NHS for over a decade, I can personally attest to the enormous strain our health and care systems have been under. And when a deadly virus has been thrown into the mix, it's a sheer miracle that the system didn't break. But that's only thanks to the dedication of my former colleagues in the NHS, not because of any leadership from the top. The vast majority of the problems facing our NHS are down to an absence of leadership. The reasons why my constituents and yours cannot see their GP, get an NHS dentist or have their surgery cancelled multiple times is due to one simple fact. Successive governments have failed to do proper integrated workforce planning. The Royal Colleges and the professional bodies have been warning for at least the past decade that we are not training or recruiting enough frontline staff. And the Welsh Government are very good at creating managers, bureaucrats and red tape, but are absolutely useless when it comes to creating doctors, nurses and healthcare professionals. And things have improved somewhat, so I do give credit where it's due. And with the creation of the HEIW, we now at least have a workforce plan, but I fear it's too little too late. And just last week, the RCN released their report on nursing staff levels, and it was a sobering read, because the sheer numbers of nurses leaving the profession should worry us all. There are at least 1,719 nursing vacancies across Welsh health boards, and over the past 5 years, we've spent around £1/3 billion on agency staff. The RCN report shows how we are losing almost as many staff as what we are recruiting. And last year, the workforce only grew by 0.1%. We gained a handful of nurses last year when we needed thousands. We lost 6% of the district nursing workforce between June 2020 and June 2021. And in a survey of its members, the RCN highlights that 1/3 of nurses are strongly considering leaving the profession early, all due to chronic workforce pressures. We are in real danger of creating a negative feedback loop. People leaving healthcare because of the pressures of not having enough staff. And it's not just nurses feeling this pressure. It perpetuates across the health and social care system. General practitioners are also leaving the profession in their droves. GPs are retiring early, and some even surrendering their medical licence, meaning that they can't be called out for retirement in times of crisis. We were warned that the BMA nearly 10 years ago that we needed to recruit around 200 GPs a year in Wales. For the majority of the intervening years, we were lucky if we managed half of that. And because we failed to address the recruitment problems, we created a retention problem. In 2019, before the pandemic, nearly a quarter of practices surveyed were considering handing back their GMS contracts. Since the pandemic, things have got much worse. GPs are warning that the strain could overwhelm the system, that pressures are putting people off the profession altogether, and 1 in 8 GP trainees say they do not intend to work in general practice after qualifying as doctors, according to a recent BMA poll. All this is having a devastating effect on patients, many of whom are becoming sicker because of the lack of early intervention. My constituents tell me it can take them weeks to get an appointment with their GP, and practices cannot cope with the numbers of people on their lists. And when patients do manage to navigate their way through primary care, they face the same challenges in secondary care. Referral to treatment times were already astronomical prior to COVID and have skyrocketed since. The latest figures show that 1 in 5 of us are on a list awaiting NHS treatment. 2/3 of a million people waiting years for treatment to end their pain and suffering. 691,000 Welsh citizens left in limbo, not knowing when their treatment will begin. How many of those 1 in 5 will die because they didn't get a cancer treated soon enough? How many will be forced to give up work because their condition deteriorated to such an extreme that they are unable to function in the workplace? These are the real impacts treatment delays are having on people's lives. Patients are dying, going blind and losing mobility because they can't be treated soon enough. and they can't be treated early enough because we don't have the staff. There are currently over 3,000 vacancies in our NHS, and many in my health board in Betsy Cadwaladr in North Wales. We have 10,000 fewer beds than we did at the beginning of the century, yet we have frequently breached safe staffing levels over recent months. In recent weeks, we saw A&E departments with fewer than a third of the required staff. And if we are to recover adequately from this pandemic and be prepared for the next one, if we're unfortunate to have another one come around, we have to get to grips with the training, recruitment and retention of staff. We need true integrated workforce planning that anticipates future service demands. And let's not forget that the Parliamentary Review of Health and Social Care warned us of the challenges we face as our demographics change. We aren't planning to meet today's needs, let alone respond to future challenges. We need root and branch reform of our recruitment and retention policies, and it would help if we actually had retention policies in the first place. We need to make working and staying in health and care a more attractive proposition. We need to encourage more young Welsh people to pursue careers in health and care. We need a workforce plan that looks at the whole picture, from science teaching to retirement planning and everything in between. It's time to join up the dots, and that requires leadership. It requires a Welsh Government that can plan for the future. I urge the Minister to grasp this nettle now and make workforce planning her #1 priority. Otherwise, my mailbag and yours will continue to overflow with complaints about not being able to get a face-to-face appointment with a GP, about not being able to see an NHS dentist, or about not being able to get a suitable care package for an elderly relative. We can't afford to lose any more NHS staff, and my constituents can't wait any longer for treatment. Diolch yn fawr.
Good.
And I'm grateful to the member from the Vale of Clwyd for bringing forward this short debate, and the Minister won't be surprised that I'm bringing forth the Argyll Medical Group and Argyll Street Surgery as my example this evening. This is one of Wales's largest GP surgeries, with a patient ratio approximately 2,506 patients per GP. This is a real burning issue in my mailbag, as constituents cannot get access to healthcare services, and I understand the need to move away from just seeking GP services, and we can move away to looking at nurses, physiotherapists and pharmacists, but there's still real issues within this GP practice in Argyll Street, and I do pay tribute to Judith Schofield, the practice manager, and the staff at Argyll Street. They are working incredibly hard, but I do feel there needs to be something targeted here to really support them in what they're trying to deliver in my part of the constituency. Diolch, Deputy Llywydd.
I call the Minister for Health and Social Services to reply to the debate. Lynn Morgan.
Well, I'm grateful for the opportunity of this short debate today to discuss the important topic of access to health services. Now, under a Labour government here in Wales, there are now more doctors, nurses and other healthcare professionals working in the NHS in Wales than ever before. Over 104,000 people and 89,000 full-time equivalents. 3,600 more staff than at the same time last year. And far from being absolutely useless, since 2016, the number of medical and dental staff have increased by 21%. We've got nursing, midwifery and health visiting staff up by 9%, scientific, therapeutic and technical staff up by 24%, and ambulance staff up by 39%. We are training 69% more nurses than we were before 2016. And last week, I hope you noted that we recruited 400 new international nurses. Now, we're not, however, complacent, and it's not just numbers alone that are going to guarantee the success. It's about how health professionals collaborate and use their skills, including their Welsh language skills, in the most effective way for patients. We, therefore, have a programme for government commitment to deliver better access to doctors, nurses, dentists and other health professionals, which builds on previous commitments. Action is centred around the primary care model for Wales, which is about people accessing the right care from the right professional or service for their specific needs at or as close to home as possible. Now, this means increasingly people will only travel to hospitals for those services which should only be delivered in those settings. As the National Clinical Framework Programme drives national clinical pathways, we'll make faster progress with rebalancing services, funding and the workforce away from illness and hospitals towards wellness and care closer to home. Now, in the time I've got today, I can't do justice to the huge range of policy and activity through our national programmes for primary care, for planned care, for urgent and emergency care, and for mental health to support this rebalancing of the system. So I'm going to highlight the action to improve access to those services which most people frequent and are most familiar with. And these are our primary and community services. Now, to improve access to GPs, we've introduced a change through the General Medical Services contract to remove the bottleneck at the start of the day. I provided extra funding of £4 million annually over the next 3 years to build capacity in GP practices. The primary care model is about increasing the range of services and health professionals accessible in the community. GPs and practice nurses are not always the right health professional for someone's needs, and as a physiotherapist, I'm sure you're well aware of that. For example, an optometrist is the right person to treat eye problems like red eye. Community pharmacists offer an increasing range of services, from hay fever to emergency contraception. Earwax causing hearing loss is a common problem, and we're increasing the availability of community audiologists. Now, I'm very aware that one of the biggest areas of concern for people in terms of access is dentists. Managing the infection control requirements of COVID has meant a lot less capacity in dental practices. Reforming the dental contract is our main policy driver to deliver that better access, and we'll create more capacity for new patients by moving away from the historic 6 monthly checks for all to a service based on individual need and prevention. Now, for many people whose oral health is good, they only need to have a checkup once every 2 years. We do need to communicate this better to the public, and I welcome members' support in conveying that message. Now, last month, I launched our new 6 goals for urgent and emergency care programme. I'm supporting this with £25 million of investments. Key developments enabling better access are the 8 new urgent primary care centres across Wales, with 2 more opening shortly. And our 111 telephone service is now available across the whole of Wales. The 111 press 2 directs people to mental health wellbeing support. Also in April, I published our programme for transforming and modernising planned hospital care and reducing waiting lists. Now, importantly, the plan also signals the transformation of community-based services to offer different options designed to support a person to do what matters to them. We are moving steadily into a new phase of the primary care model. This phase is about increasing the visibility and development of community services, where the focus of leadership and investment is on wellness, independence and integration of health and care. A recent King's Fund paper on what we could learn from the pandemic states that a successful and sustainable recovery is possible if there is investment in the resilience of communities and community-led approaches, with individuals and communities in the best possible health to cope with what comes next. Fel rhan o'r rhaglen strategol ar gyfer gofal sylfaen.
As part of the strategic plan, there is a specific network also on well-being. This offers a basic pathway for mental well-being that will be a basis for planning work. There are other commitments under the programme for government for community services. Developing a national framework for social prescribing is one of them. The new integrated regional fund that's worth £144.7 million continues to move us closer to realising our vision in a healthier Wales, a vision where Wales has one health and care system with integrated care that concentrates on health and well-being and on preventing illness, systems that enable people to benefit easily from a wide range of services in their communities. To close, I think we can agree that a wide variety of measures are being developed to improve access to healthcare, but there is more to come again. As well as improving access for individuals, I want to see these improvements making a positive difference to those who provide the services. Their commitment is constant, and it's important that we support people in their communities, and the support that they have provided to the public has been exceptional. Thank you very much.
I thank the Minister, and that brings today's proceedings to a close. Thank you, everyone.